Now we'll see few basic things about the ECG leads. So the standard ECG has 12 leads, 3 standard limb leads, 3 augmented limb leads, and 6 precordial leads, which are also called as chest leads. So limb leads are 1, 2, 3. Each of the leads are bipolar, that is, they require two sensors on the skin to make a lead. If one connects a line between two sensors, one has a vector. So there will be a positive end at one electrode and negative at other. So the positioning for leads 1, 2 and 3 were first given by Enthoven. So it is called as Enthoven's triangle. So here you can see the position of V1 to V6. So these are the precordial leads, or you can say the chest leads. So here the V1 is placed in the fourth intercostal space to the right of sternum. V2 is placed into the fourth intercostal space to the left of sternum. V3 lead directly between the V2 and V4. V4 is in the fifth intercostal space at mid-clavicular line. V5 at the level with V4 but at the left anterior axillary line. V6 the level with the V5 but it is at the left mid axillary line. So according to this position the view of heart is C. So V1, V2, septum of the heart, V3, V4, anterior portion, V5, V6, lateral portion. So you can see this. So this is the mid clavicular line, this is anterior axillary line, and this is mid axillary line. So this is the position of leads. These are the precordial leads V1 to V6, which are also called as chest leads. So this is very important where you are going to place your electrode. Same thing but in other view. You can see V1, V2, V3, V4, V5, V6. V1, V2 septal, V3, V4 anterior, V5, V6 lateral. Now ECG paper, if you see this ECG paper, I have magnified a small square into a large square. If you see the horizontally, one small box is equal to 0.04 second. So this one small box is equal to 0.04 seconds. And this one large box is equal to zero point 0.2 seconds. If you see the vertically, one large box one vertically one large box is equal to zero point 0.5 millivolt, zero point 0.5 millivolt. So remember, one small box 0.04 second, one large box 0.20 seconds. Clinical interpretation of the ECG. Accurate analysis of ECG require thoroughness and care. The patient's age, gender, and clinical status should always be taken into account. Many mistakes in ECG interpretation are errors of omission. Therefore, a systematic approach is essential. So, this is a picture of normal ECG. You can see the ECG waves. This is a P wave. This is QRS, that is QRS complex. So from S to 2, this is the ST segment, and this point is called as J point. This is very important, ST segment. So this point is called as J point. ST segment is important for the ischemic heart disease, and this is your U wave. So this is the QRS interval, this is the QRS interval, and this is QT interval. So this is the normal ECG. Again, the full picture: 1, 2, 3 limb leads, augmented leads, and V1, V2, V3, V4, V5, V6. These are precordial leads. So these are the points which are to be analyzed carefully in every ECG. So first thing is the calibration and technical features, including the lead placement, then rhythm, heart rate, PR interval, QRS interval, QT or corrected QT interval, mean QRS electrical axis, P wave, QRS voltage, precordial R wave progression, abnormal Q wave, ST segments, T wave, and U wave. So, this is very important checklist, should be analyzed carefully in each SCG. Now, how to evaluate the rhythm? Evaluate the rhythm strip at the bottom of 12 lead for following. Is the rhythm regular or irregular? Is there is a P wave before every QRS complex? Are there any abnormal leads? So you have to check whether the rhythm is regular, whether the P wave is followed by QRS complex. You have to check. So that is how you should check for the rhythm. Now, heart rate. So, how will you calculate the heart rate? So, rule of 300 or 1500. 10-second rule. So, what is rule of 300? Count the number of big boxes between the two QRS complexes. So, two QRS complexes you have to check. So, if you see a big square, then count the number of big boxes between the two QRS complexes, and there you have to divide this into 300. Smaller boxes with 1500. If you check the big box, then it should be 300, and if you count smaller box, then it will be 1500. So this is a rule of 300. So remember this: count the number of big boxes between two QRS complexes and divide the number into 300. If you take smaller boxes, then with 1500 for regular rhythm. So here you can see the QRS complexes, and you can see a large box here: 1, 2, 3, 4, 5, and we can consider this half and this as a 6. So 300 divided by 6, that is number of large boxes. So approximately 50 beats per minute is the heart rate. So I will repeat rule of 300. You have to take two QRS complexes and you have to count large squares in between two QRS complexes, and you have to divide those number. So 300 divided by 6 is equal to 50 beats per minute. Here this is the QRS. So 1, 2, 3, approximately 4. So 300 divided by 4, 75 beats per minute, which is normal. Here very less, so you can take one and half. So 300 divided by 1.5, that is 200 beats per minute. So this is tachycardia or tachyarrhythmia, you can see.